So in this video we are going to look at the extrinsic muscles of the forelimb, as well as we'll look at some of the other structures which are associated with this dissection. As we have reflected the skin from the trunk, we can see along with the skin we see the superficial fascia still attached with the skin. We have part of the cutaneous trunci, which is the superficial muscle of the trunk, which basically is present between the two layers of the superficial fascia, which can be seen here. With some fat deposited on both sides, so the muscle is completely present within the superficial fascia. So that is your cutaneous trunci, which has been transected here. Further, it will go deeper on the medial aspect of the humerus to get attached to the bone, and that is the only site where it attaches to the bone. The rest of the muscle is widespread on the trunk and is more associated with the skin. As we reflect the cutaneous trunci, we now expose the extrinsic muscles of the forelimb. Extrinsic muscles of the forelimb are those which connects the forelimb to the rest of the body. It connects the forelimb to the rest of the body by means of those 8 extrinsic muscles, and that will be called synsarcosis, a specific type of attachment between the forelimb and the trunk, which is different from the hind limb. First of all, let's start looking at the extrinsic muscles from the caudal aspect. So we see here, that is the latissimus dorsi. The muscle extends from the thoracolumbar fascia, and it further goes towards the humerus to get attached to the teres tuberosity of the humerus. That is the ventral border of the muscle, and we see the muscle fibers going towards the dorsal midline, where the aponeurosis seems to be merging with the thoracolumbar fascia. Then as we come further cranially as well as dorsally, we see trapezius. We can palpate the spine of the scapula on the shoulder of the dog, or on the scapula of the dog in the shoulder region. That is the distalmost point of the spine where the acromion process would be present, and we can palpate the line where the spine of the scapula is present. Now the trapezius is another extrinsic muscles which is coming from the dorsal midline, having two different parts, part of the muscle which is associated more with the trunk of the animal, and the part which is associated with the neck of the animal. And so this part of the trapezius is thoracic part of the trapezius muscle, which also attaches to the spine, while we have the cervical portion of the trapezius muscle which also attaches to the spine. So this part specifically which overlaps the latissimus dorsi partially, that is the thoracic portion, and the part which goes further towards the neck or towards the dorsal midline of the neck, that is the cervical portion of the trapezius. Both of them attach to the spine of the scapula. As we come further cranially towards the neck, we see another muscle, or at least part of that. Rest of the muscle is covered by the brachiocephalicus. This muscle right here is the omotransversaris. Omotransversaris, it comes from the shoulder, basically from the spine of the scapula. It continues further and it inserts on the wing of the atlas, which is basically the transverse process of the cervical vertebrae, and hence it is called omotransversaris. The next muscle we are going to look at is the brachiocephalicus, the muscle which runs from the brachium to the head. The muscle at its attachment towards the arm or brachium is much narrow or tapering, while towards its attachment on the neck as well as on the head, the muscle becomes much more widespread. As a remnant of the bone clavicle in the dog, we have clavicular intersection which can be palpated in the middle of the muscle. That line indicates the clavicular intersection. From the clavicular intersection towards the brachium, the muscle is called, or part of the muscle is called, cleidobrachialis, while from clavicular intersection towards the head as well as towards the neck, the entire portion is called cleidocephalicus or cleidocephalicus. The cleidocephalicus is further divided into two different portions. The portion which moves or which runs towards the mastoid process of the skull, which is called cleidomastoideus, and the part which goes towards the neck or dorsal midline of the neck as well as towards the occipital bone of the skull is called cleidocervicalis. In this dissection, we also have transected the brachiocephalicus, and we can reflect the brachiocephalicus, which actually enables us to see the more part of the omotransverse areas, which is moving further towards the atlas or towards the transverse process of the first cervical vertebra. We can put this back, and then let's come back to the brachiocephalicus. So brachiocephalicus as an entire muscle with two different parts from the clavicular intersection, cleidobrachialis and cleidocephalicus. The cleidocephalicus is further divided into cleidocervicalis and cleidomastoideus. As we transected the brachiocephalicus, specifically we can see the part of the cleidocervicalis has been transected. As we reflect it more laterally, we can see a little spindle-shaped part, or which is a little thicker than the flat cleidocervicalis, that is your cleidomastoideus. Both of them actually diverge from each other from the clavicular intersection. The cleidomastoideus part is also going to be accompanied by sternomastoid portion of the sternocephalicus muscle. So they are very closely associated with each other. Remember that sternocephalicus is not an extrinsic muscle of the forelimb. So from brachiocephalicus, we move further towards the medial aspect. Here some of those muscles have been transected. So as we put them back in their order, we can see from the ventral midline, the muscle which goes from the sternum. If the limb is held in the actual position the way it would be in the live animal, the muscle seems to be running backward to get attached to the humerus in the arm of the forelimb, that is your descending pectoral muscle. Slightly underneath the descending pectoral, we have a flat muscle which also arises from the sternum, almost in the same region as the descending pectoral. The muscle is more flat in nature, which also inserts on the humerus of the arm, and this is called transverse pectoral muscle, as the fiber direction of the muscle is exactly transverse to the median plane, or we can say the main axis of the body, that is the transverse pectoral muscle. The transverse pectoral along with descending pectoral, as they are located more superficially, both of them combinedly are called superficial pectoral. As we move further backward, we see the larger muscle which originates from the sternum and get attached to the humerus, close to the proximal end of the humerus in the shoulder region, that is the deep pectoral muscle. The muscle seems to be much more widespread, much more bulky, but as it comes more cranially, it is covered by the superficial pectoral muscles, and so this muscle is also called ascending pectoral muscle or deep pectoral muscle. So in order to differentiate between superficial pectoral and deep pectoral, descending pectoral and transverse pectoral combinedly would be called superficial pectoral, and ascending pectoral alone is called deep pectoral. In this dissection, we still see some more part or some leftover of the cutaneous trunca again going deeper to get attached on the medial aspect of the humerus, as well as latissimus dorsi now can still be seen as we move around the forelimb or scapula, which attaches forelimb to the rest of the body. On the lateral side, as you see the dorsal aspect or dorsal midline and the shoulder region of the forelimb, brachium of the forelimb, antebrachium of the forelimb, and manus of the forelimb. Here we transect the trapezius, the cervical, the thoracic portion, reflected laterally, as well as we transect the cervical portion of the trapezius, reflected laterally, as well as along towards the dorsal midline, also reflecting the cut portion of the cleidocervicalis in order to expose the another extrinsic muscle of the forelimb, which is attached to the dorsal border of the scapula on its medial side. part of the muscle which actually is attached to the thoracic region. We see the cut portion of the trapezius. Well, we see the muscle underneath the trapezius, that is your rhomboideus. This part is associated with the thoracic region, so it is rhomboideus thoracis. The part of the rhomboideus which continues further cranially, as long as it is associated with the neck, it is called rhomboideus cervicis or cervicis, and then the part of the rhomboideus which continues further even more cranially to get attached to the skull is called rhomboideus capitis. So the thin strip-like muscle which can be differentiated more cranially from this rhomboideus cervicis, that is the rhomboideus capitis. So rhomboideus capitis, rhomboideus cervicis, and rhomboideus thoracis, those are the three parts of the rhomboideus muscle which attaches to the scapula along the dorsal border, but more medially, and then it is coming from the dorsal midline of the thorax, neck, as well as coming from the head. Now we are looking at the forelimb after transecting the deep pectoral muscle as well as superficial pectoral muscles. We try to push the forelimb away from the trunk, and we see another extrinsic muscle, which is the largest one, has its serrated edge which connects scapula from its medial aspect to the rib cage as well as to the neck. And so this is your serratus ventralis muscle. The part of the muscle which is present on the thorax is called serratus ventralis thoracis, and the part of the muscle which is present on the neck, specifically on the cervical vertebrae, is the serratus ventralis cervicis or cervicalis. So this is your serratus ventralis muscle. After removing or after transecting the serratus ventralis muscle and rest of the extrinsic muscles, we should be able to take the forelimb completely off the body after we cut the blood vessels and nerves which are coming into or which are going towards the forelimb. In this view, we are trying to remove the forelimb, and then we'll see the relation between the serratus ventralis and the attachment of the serratus ventralis on the scapula from its medial side. As all the extrinsic muscles have already been transected, it's now quite easy. We can just flip the forelimb and we can see the medial view of the shoulder region, which is formed by the scapula. Here we see the thoracic wall, and that is the extent of the serratus ventralis. From around rib number 8 all the way to the cervical vertebrae, that muscle with serrated margin is fan-shaped muscle which is extended from the thoracic region to the cervical region. As we reflect some of these muscles, we can see remaining part of the serratus ventralis associated with the neck, and we can see the area where it is attached to the scapula on its medial side. This is the attachment area for the serratus ventralis on the scapula, while rest of the area or rest of the part of the subscapular fossa is occupied by the subscapularis muscle. That is the gut portion of the rhomboideus muscle, which is another extrinsic muscle, and we can see remaining part of the rhomboideus, the thoracic portion as well as cervical portion and the capitis portion, still attached to the trunk of the animal. Along with the extrinsic muscles of the forelimb, as we transect the brachiocephalicus and expose the omotransversaris muscle. After transecting the omotransversaris, you will also find the superficial cervical lymph nodes, which are located in this region. The superficial cervical lymph nodes, which are also known as prescapular lymph node, they are responsible for draining the head, neck, and the entire forelimb.